Welcome to this special edition of the Southern California Medical Report. I'm your host, Sally Shamrell. Most of us lead fast-paced lives, and we love the convenience of 1-hour photo labs, 1-hour alterations, and 1-hour dry cleaning. Well, today we're going to introduce you to a place that performs 1-hour tooth replacement. We've discovered one of the leading dental institutes in the nation, the Sargon Dental Institute, right here in Encino, California. Now let's listen to some news reports on this procedure.
NBC 15 News starts.
An FDA-approved tooth implant system has transformed what has always been a 4 to 6 month ordeal into a 1-hour procedure.
KCRA 3 reports at 6.
Whether you need just one or
plant. They didn't want to walk around looking like a hockey player who'd been hit in the mouth with a hockey puck. But now the FDA has approved a new procedure and allows people who need new teeth to get those teeth in 1 to 2 hours.
A new FDA-approved tooth implant system after they get the implant.
I had a sandwich after an hour and a half after the implant, but I still cannot believe it.
What you're about to see will change your view of implant dentistry forever. What has been called the biggest revolution in modern-day dentistry will expand your treatment capabilities with virtually no downtime. For you, the patient, leave with a functioning temporary tooth, and the restorative process begins while maintaining tissue health. Let's look closer at how the Sargon Dental Implant works. Inside the implant is a fixed screw. At the bottom of the screw is the expansion nut. By turning the internal screw, the expansion nut travels upward, expanding the tip portion of the implant. Because the implant is wider at the tip, the lateral forces of closure are expanded. You have the ability to directly feel the bone adjacent to the implant. At this time, you're in direct communication with the bone. And the implant tells you if the bone in that site can be immediately loaded. Expansion of the implant compacts the localized bone, encouraging reparative growth and osseointegration. Now let's do a comparison of prior implant techniques and the Sargon technique. Under the prior procedure, a patient may expect tooth removal. Then they begin the restoration process. Well, this process frequently takes from 1 to 2 years. With the advent of the Sargon implant system, representing the future of implant dentistry, this entire process can be performed in a matter of hours. This surgical procedure shows the placement of a Sargon dental implant in the left central incisor, following tooth removal. All soft as time. The temporary tooth is fabricated and delivered. Sargon dental implants can be used for a single tooth or full mouth reconstruction, or even over the denture. The Sargon dental implant more closely duplicates, redefining success in implant dentistry. For product information and surgical courses, contact Sargon Dental Implants at 818-380-9057. And remember, all aspects of dentist described in the industry is the first major innovation in dental implantology since the early work of P.I. Branemark. Dr. Sargon graduated with honors from USC in 1986 and currently holds 15 dental patents. Dr. Sargon has authored several articles and a textbook on the Sargon immediate reports. Dr. Sargon actually invented the immediate load implant. Hi, doctor.
Hello.
How did you first come up with the idea for immediate tooth replacement?
Well, I used to use the traditional implant systems in the late 80s. And it was then that I started thinking about what would happen if we take these implants and expand them and lock them in bone at the time of placement, and whether we can put a load or a tooth on top of this implant immediately. So I started working with several engineers, and we tried different designs. And first prototype that we put in use was the proper candidates for the implant is whoever is missing a tooth or is losing a tooth or teeth.
How do you help people who need to undergo root canals or have dentures or partial dentures?
Well, people who have root canals, once the tooth has been root canaled, the blood supply from the tooth is gone. So we do have a lot of failing root canals or fracture.
Hundreds of thousands of senior citizens, of course, that are currently using removable prosthetics or dentures. Tell us how they benefit from the Sargon implant.
Well, as you know, these prosthetics are very uncomfortable. They're basically sitting on top of the gums and on bone, and they're floating. And these patients have to, one of the options to do, it's a very simple procedure that we put 3 or 4 implants under these dentures and just basically lock them in place. So when the patient puts this denture in, it locks onto those implants. They would still have to take them out and clean them, but they have anchorage inside the mouth, which is much more comfortable than traditional procedures.
The Sargon Dental Institute is located here in Encino, California, and has made major breakthroughs in dentistry.
Procedure that will have you in and out of the dentist chair in no time. The 1-hour tooth replacement, it's true. The dream.
Getting new teeth can take a long time.
But next on KCRA 3 Reports at 6, Dr. Tom Hopkins shows us how a new
procedure and allows people who need new teeth to get those teeth in 1 to 2 hours.
A new FDA-approved tooth implant system tops tonight's health check. A study published in the Journal of Prosthetic Dentistry.
For 6 months or whatever, I walked out with a tooth.
How does the Sargon implant compare to traditional implants?
The Sargon implant is made of the same material, titanium, as the traditional implants. What is different about it, it's the fact that it's an expandable screw. So once it's screwed into the bone, it has the capability to expand and anchor itself in bone. So by anchoring itself and just to have normal diet right after the procedure. It's different with different patients. Some patients, they do feel some discomfort around the gums, but normally most patients report that they had a meal right after the surgery.
I also heard that besides training dentists
and be trained in this procedure, and we also have other institutes around the world that teach the Sargon implant procedure.
Now, I've also heard that others are attempting to use procedures that claim to have immediate tooth replacement. How do patients protect themselves from imitators like that?
Well, unfortunately, in any business area, and promote immediate loading screws, which you can imagine the success rate would be just like the old days. So consumers should be very careful when they're asking for this immediate load procedure. Find out that this implant is specifically the Sargon implant. It is the only implant that can expand and anchor itself in bone and be immediately loaded.
We're at the Sargon Dental Institute in Encino, California. Joining me...
All my worries were in vain, because when I talk, I feel very comfortable about how I sound.
And how many implants did you need?
I need 3. When I talked with Dr. Lazaroff, that was wonderful, because he answers all your questions, all your concerns, and spends all the time in the world.
In place and done, and it's over. And you're thinking, why was I so nervous? That was nothing. I'm really amazed by that. I think my implant is stronger than my other teeth, which I don't see how that can. I asked my dentist, I said, is it possible? And he said, yes, they are stronger. That
One of the major benefits for patients is that when the practitioner has undergone the learning curve, the surgical procedure can be done in a very, very easy and simple way so that the patient experiences what is almost a non-surgical procedure. They can function with, and they don't experience anything that they would normally feel from a surgical procedure. And this is the most amazing thing about this implant system.
Having to wear flippers, and when they find out that they can get a tooth right away, they're more anxious to get the work done. I see a lot of patients that are involved in industrial accidents. Patients will be working on a machine, a part will come up, fly in their mouth, fracture a tooth, they'll break off at the gum line, or they'll lose the entire tooth. Insurance companies have been extremely responsive. They can send the patient to me. I can
have a problem with their front tooth, and literally extract the tooth, put the implant in and place it temporary, and they can go home in an hour or less. And that kind of technology for the general dentist to have, at his disposal is just fantastic. And
Patients, tell us what you did with Shaku.
Well, Shaku, what we did on her was something that is quite new, and that is making of final crowns at the time of placement of the implants. Her biggest issue was a cosmetic problem and also severe gum disease, which had caused her teeth to... The procedure that we did was we took out the teeth, replaced them with Sargon implants, and put final crowns, Astenia crowns on there. So at the time that we did the surgery, you can see the change in her smile, and you can see the change in her aesthetics of the teeth.
Hole there, so I clean out the hole, put the implant, expand the legs. It's an expandable implant. Put a denture tooth as
the implants before I started using the Sargon implant. And when it was time to use this particular implant, actually, Dr. Sargon Lazaroff came out to my office, spent a couple hours with me, and prepped me on the few subtleties and differences in the system. I have a book that he's written that I used as instructional material. Patients, and we're restoring them to a function that they never thought they could get. So they're happy, we're happy. It's like a miracle. You get to get back something you thought was gone forever.
Thanks for watching the Southern California Medical Report. I'm Sally Shamrell. We'll see you next time. Contact Sargon Dental Implants at 818-380-9057.